Medical staff here are on the front line. Mongvalo in Ituri is the Ebola epicenter. They have been working without adequate support, but their commitment remains unwavering. Grace Kakure has been a nurse here for 5 years. Aged 27, she was confronted by Ebola from the very start. It was declared late and the hospital was under-equipped. Grace saw 5 of her colleagues die from the disease, all infected at their workplace. Despite the grief, she stayed.
At the beginning, the epidemic was spreading quietly. The official declaration came after we had already been in contact with patients. What contributed to the infections was our dedication and our care for the sick, because all of those infected were healthcare workers. Even though we lost nurses from this hospital, we've remained resilient. Because if we don't keep going, we'll be sacrificing the lives of others.
Fear of Ebola has even robbed the sick of healthcare. 20 people used to come to the hospital every day, but once the outbreak was declared, they stayed away, fearful that it was the source of the sickening.
After the epidemic arrived here, we noticed some people refusing to come to the hospital, claiming that the epidemic was in the hospital itself. Nevertheless, in recent days, we've seen a slight increase in attendance. People are coming from other areas to receive treatment here. We've got used to it. This is the profession we chose.
About 20 doctors and nurses have already died after contracting Ebola in Ituri province alone. Those who remain feel left behind. Many are not being paid properly. Some died without officially being recognized as public employees in DRC.
This is not a good situation. What we ask of the government is firstly to include us among those who receive hazard pay. Secondly, to remember Mongvalo. Mongvalo has been forgotten by everyone for a very long time.
Despite logistical and financial challenges, the fight against Ebola is continuing on the ground thanks to people like Grace Kakure, who remain committed to serving their community.